We're going to talk a little bit about aphasias today. And whenever somebody has a stroke, they can have any kind of aphasia, and we want to be ready to be able to differentiate. And in the test, they may ask you about what kind of aphasia this patient has. So, some of the things you want to be mindful of is that it's a language disorder which results from a damage of particular part of the brain responsible for language, but different areas of that language centers can cause different kinds of aphasias. So, like it can be fluent aphasia or non-fluent aphasia. In fluent aphasia, the speech is not broken, so there is fluency is intact, and um, there are characteristics which you want to think about, like, for example, like this picture is taken from aphasia.org, and I want to give them credit for this picture. So you want to think about fluency, comprehension, and fluency, comprehension, and repetition. So the way you want to think about is like if there is no fluency, but the patient has comprehension and is able to repeat, then you have transcortical motor aphasia. If patient has no fluency, but can comprehend, but doesn't repeat, then he has Broca's aphasia. If a patient is not able to fluently speak and not able to comprehend, but is able to repeat, then it's mixed transcortical aphasia. If a patient is not fluent, cannot comprehend, cannot repeat, that's global aphasia. So let's come to the aphasias where you have patient is able to fluently speak and is able to comprehend and is able to repeat, then it's anomic aphasia. A patient who is able to speak fluently, but is not able to comprehend, but is able to repeat, they have transcortical aphasia. A patient who is able to fluently speak, but is not able to comprehend, is not able to repeat, has Wernicke aphasia. A patient who is able to fluently speak and comprehend, but unable to repeat, has conduction aphasia. So use this and also this chart to help yourself orient yourself with what are the main things, how to differentiate it. So the factors which differentiates, you want to know fluency, you want to know comprehension, and you want to know repetition. These are the three factors which lead to you helping you to find out which kind of aphasia it is. And if you go to aphasia.org, you will find the chart, and they have done a good job in helping us understand. So there is other kind of aphasia where you have gradual loss of language abilities, and you also, this is associated with neurodegenerative diseases. And then also there is crossed aphasia, which is caused by right hemisphere damaged in right-handed individuals. So I hope this helps. And again, going back to this diagram of aphasia, giving credit to aphasia.org, the things you want to be mindful is fluency, comprehension, and repetition, and have this chart in mind so that it helps you. If I think you should create a flashcard with this and understand, and like, because it's a couple of questions, maybe one question or two questions, and you want to be looking at these three dynamics: fluency, comprehension, and repetition, to be able to answer any question related to aphasia. Thank you.